Dr. Jaffe, can you help us understand the difference between testing cooked food versus raw foods when we're looking at the LRA by ELISA Act test and delayed hypersensitivities? Is there a difference?
Is there a difference between measuring the antigenicity of a cooked food versus a raw food in regard to the, say, measurement of antibodies or the measurement of lymphocyte responses? And logic would say that since people mostly eat cooked foods, that you might want to test with cooked foods. Here's the problem as a biochemist, as an immunologist. The problem is that when you cook the food, you denature the food. Denaturing means that the native structure is lost due to heat and the other conditions of cooking. And now, if you measure antibodies, you will get lots of cross-reactive antibodies due to the denatured epitopes. The denatured protein reforms, basically reshapes itself randomly, and you'll get some reactions. But what is the meaning of a reaction to a denatured, reconfigured antigen? It's a rhetorical question. The answer is no known meaning in immunology. And so when this question first came up, because there are labs that specialize in using cooked foods, and then they do antibody tests of one sort or another, and they say this is better. So I looked in a dozen immunology textbooks, and every one of them said, when you cook foods, you denature the food loses its normal immunogenicity, and when you measure reactions to the cooked foods, you're getting artifacts. You're not getting measurable improvements in that specific food's reactivity in the body. And if I understand correctly, the labs that offer these cooked foods do it on the basis that that's what people normally eat. And that is true. People eat cooked foods and then some raw foods, but that's not what the body's immune system recognizes, because we have a microbiome. We have a digestive tract. And the digestive tract, when it completely breaks foods down to the amino acids, diantripeptides, to the molecular sugars, to the short-chain fats, and other very tiny items, there's no immune recognition, because you have to have a certain size and shape before the immune system recognizes you as foreign. In the test tube, if you're doing a standard ELISA, a 5 or more step procedure with at least 15% variance, and one of those steps looks for a cross-reactive antibody, you're going to find them. But of what clinical meaning? No textbook, no article that I can find in Index Medicus or PubMed says that it's better. In fact, there are articles that say you shouldn't use cooked foods if you want to determine the immunogenicity or antigenicity of a specific item. And our point, the LRA by ELISA Act point, is that you want T cells, which react without antibodies. You want meaningful measures of the T cell reactions. You want to be able to observe immune complexes if they're there through a true ex vivo lymphocyte response assay, the ELISA Act procedure, the first and only one to bring together enzyme amplification and cell culture. And what's unique about ours is 1 step, not 5, because an enzyme on the surface of the lymphocyte is what activates when a pre-programmed antigen is presented by an APC, an antigen-presenting cell. You can only do that with a ex vivo lymphocyte response assay. So there are many reasons to measure both T and B cell reactions functionally. There's no reason, in my understanding, of why cooked foods would be better.